Hello, my name is Mikael Nordfors, and now comes part 6 in my course in tendon attachment therapy, and this one is how to heal the muscles of the thigh. While watching this video, please stop it between each slide and try to find all the mentioned tendon attachments on yourself or a friend. This will literally give you more of a hands-on experience. The first muscle is called quadriceps femoris. It's a very important and big muscle, and it has 4 heads, just like it says. Quadri is 4 in Latin, and ceps is head. The heads are called Rectus femoris, Vastus Intermedius behind, Vastus Lateralis on the lateral side, Vastus Medialis on the medial side, and the insertion is on tuberositas tibia, the tibial bone down here, and it has a sesame bone called patella that makes it more powerful. The first one, rectus femoris, the insertion is on spina iliaca anterior inferior, just above the back of the hip, and just above the back of the hip socket, acetabulum. And the attachment is down here. Here you see better. This is the anterior inferior spine, rectus femoris origin, and here just above the acetabulum, the hip joint. This is more laterally and this is more medially. If you have a problem to find this insertion, you can just ask the patient to kick his leg a little bit, and then you can feel the tendon up here and get the right spot. This is a technique you can use always when you have problems finding an insertion or attachment. Vastus Intermedius has the origin on the front of the thigh bone here. Points all over the place. Vastus Medialis has on the insertion origin here. The most important points are just here, like 1/3 down to the knee and 2/3 up to the hip joint. But you can search for tender points throughout the entire inside back of the thigh bone, as you see here. This is the origin on the whole thigh bone from the back of Vastus Medialis. Vastus Lateralis is on the other side, the lateral side. And the most important points are like in the middle between the hip joint and the knee joint. Here on the outer side you press this direction. But you can find points all the way up and all the way down, and also a little bit on the back. Then comes Sartorius, or the talar muscle. It has the origin on the anterior superior iliac spine of the pelvic bone on the medial surface. And it comes down to the anteromedial surface of the upper tibia. It's called the pes anserinus here. It's 3 muscles going together in a common insertion here. It's called gracilis, Sartorius, and semimembranosus. Here you see the Sartorius insertion and the gracilis and semimembranosus here. And this is the tibia. This is the attachment of the patella or the quadriceps. And this muscle is called tensor fascia latae. It has the name because there is a fascia here that connects the muscle to the insertion here just below the knee joint. And therefore it's called tensor fascia latae. Another muscle that joins this fascia latae is the quadriceps muscle. So this is a very important insertion. And this is also a very important point to press from the lateral side into the hip bone here on the top, very tip of it here. Here you see the tractus iliotibialis insertion just below the patella and tuberositas tibia, a little bit lateral here. You can find it. Then we have the hip adductors. They are very involved in especially hip problems because they press the head of the femur very strongly inside the hip joint here and cause osteoarthritis. They have the origin on the pubic bone here. This is the pectineus, you can see here, and the adductor brevis on the pubic bone. And then they also on the sitting bone. This is the lower arch here, where the adductor longus, adductor magnus goes, and the gracilis that joins the pes anserinus down here. not the pes anserinus, yes. Here you have adductor magnus, the major one. It has the origin from the rear inside of the sitting bone, and it goes down to the inside of the thigh bone, and this is an important point called the adductor tubercle. You can see it also here. Then we have the semimembranosus and the semitendinosus muscles. They bend the knee joints, also called hamstrings, and they come from the lateral posterior part of the sitting bone. They go down below the medial side of the tibia head, and this is a very important point when you have back problems, because this muscle is very close to the obturator internus. And so when this one is tense, the obturator internus have a tendency to react as like the same muscle, and the obturator gets tense, it can tense the piriformis, and then you get lots of problems with the back also. So the back is very often connected to this point. Never forget this point when you treat the back patient. And here's the biceps femoris. It has the origin on the tuberositas of the ischium and the linea aspera of femur, on the back of the femur. And this is the lateral side of the sitting bone, and it goes down to the top of the fibula here, just between the fibula and tibia. Here you have a cross section of the thigh. Rectus femoris is forwards, and here is Vastus Intermedius, and here is Sartorius, adductor longus, adductor magnus, gracilis, semimembranosus, semitendinosus, biceps femoris here. Here you have the same, but here's the anterior side here. So this is the rectus femoris, Vastus Intermedius, Vastus Lateralis, biceps femoris, semitendinosus, semimembranosus, adductor magnus, gracilis, and adductor longus. And that was all for today.